Welcome back to Dolo Factor Live. In a moment, we'll take your calls. But first, I want to ask Dorothy about Faces of Cancer. I know you started saying, that you founded it and how it started. But what is it about now? How do you help?
Okay, so when I started Faces of Cancer, what the intention was to offer support to people going through chemotherapy, in that we know when you're going through chemotherapy, you become very weak for a short period of time. So we were going to go out to people's homes, help them with their chores, if they have any kids that they cannot take care of, help them with the kids, go to the doctor's visits with them, during chemotherapy, because most times you want to take your mind out of what's going on. So we'd sit with them at the doctor while they're going through their chemotherapy. We'd go to the hospitals, pray with them, go to their homes, talk to them, explain things to them. So it was all about offering that type of support to cancer patients. But what we did find out very shortly after that was that there was a lack of education. So what we started doing was trying to bring in professionals to talk about the different aspects of cancer. So far we have had some very interesting conversations. We have talked about sexuality after cancer. We have talked about emotions, just how do you look after cancer, what could be done to make yourself look more pleasing to your partner after cancer. So we have a lot of heart-to-heart talks for women. The group has opened up quite a bit. Everybody is quite open in the group. Nothing is too big or nobody's too shy to ask any particular questions. The other thing we try to do too is have everybody have a good time. Because the aim is that not because you have cancer you are going to die. We want you to enjoy life. So we always have outings for survivors. We just had a big down the coast beach bash for us where we cooked on the beach and everything.
Sounds great.
So we do a lot of things, and it's amazing when we go out. If you don't know we survivors, you couldn't tell. Everybody's happy, enjoying themselves, playing. We just have a good time. We try to do that at least once a month. We say we meet every month, but a lot of times we end up meeting once a week, because you find that members look at it as a family and they want us to meet. So if I say we're meeting next month, I'd get calls, Mrs. Phillip, we're not meeting next week, can we meet next week? And then I have to say, okay, all right, we'll meet next week. So it's like they want to be in the group, they want to come together and be with people that have gone through the experience with them. It's also very eye-opening for them. Sometimes somebody would have a side effect and they would say, I'm feeling so and so, and it's amazing. Somebody else would say, oh, I did feel that way before. And I remember when I met Stevie for the first time, and when she was going for her chemotherapy, she would say, well, the food doesn't taste right, and I would tell her little things she can do, like don't eat with anything metallic, use plastic utensils. There are a lot of little tricks that you learn along the way, and we pass it along among group members to make them more comfortable when they're going through the chemotherapy. I try to make them laugh a lot, and they see a whole other aspect of cancer. They don't see it as a death sentence. Like I said, the group is very much alive. We just had our makeovers done during our health fairs, and it's amazing to see how we transform some of the members. So we do a lot of things with them to get their minds off of what they're going through.
Well, before you go tonight, you must give us the contact information, so if viewers want to find out more. So we'll do that a bit later on tonight. I'd like to ask if you have any questions that you'd like to ask. This is the time to call if you'd like to do so. And whilst we're waiting for that, I'll read some of the questions people have asked already. This person is asking, I still breastfeed my 1-year-old, but I have one breast which is bigger than the other. Is there any chance that cancer could be part of this?
It depends on whether her breasts were asymmetrical or different size prior to breastfeeding, and whether the infant or the baby is feeding primarily from one breast. You find that some babies have a preference for feeding off one breast, and that breast will be bigger than the other. If she is extremely concerned, or she's examined her breast and feels any lumps, I think she should see her physician to get a second opinion, to get it examined as well.
Okay. All right, we have a call. Let's go straight to the phone line. Thank you for calling Delore Factor Live.
Hello, good night.
Good night.
And how are you?
Fine, thank you.
It's a very interesting program, and I like it.
Thank you very
So,
much.
cancer does hurt?
Sorry, I didn't hear that last bit. Have you a question for us?
I asked you if cancer does hurt.
Does cancer hurt? Okay. Maybe can you answer that, please, Dorothy?
That's a very difficult question to ask. I'm not too sure I'm getting the question, but
Does cancer hurt? That's what she's asked.
okay, it depends on the type of cancer you have and what is the stage, because initially you might have a lump and it will not hurt, but as you go through, maybe towards a point where you can no longer be healed and you go in you're taking a downward trend, you will be in pain. So in that instance, I will say yes, depending on the stage of cancer you're at, you might have pain.
Now, you know, we hear many times, why should people take chemo? Just leave them alone. I just want to die. I've heard that many times. Now, is that the attitude of someone who just doesn't want to fight? Is that the attitude of someone who's just scared? Or is that someone who's just, you know what, I just don't want to be in any pain, because they just connect chemo and cancer itself with pain, and they want to maintain the standard of health that they already have?
But I think it's a mixture of both. I think when you've been diagnosed with cancer, you're scared, you may be in emotional pain, in spiritual pain, and you're confused.
Can I just ask you to stop for 1 second, because we have someone holding. Thank you for calling. You're here on the DBS.
Yes, hello, good night.
Good night.
I would like to ask Dorothy, what is her lifestyle like? I mean, diet and exercise and whatnot. What is her lifestyle like after
That's a very good
treatment?
question.
And does she believe in natural herbs, in using natural herbs as a cure, or to help her to recover?
Okay.
Because I have heard that the chemotherapy has a lot of side effects. It's very toxic. And I do a lot of research on herbs, and I've been hearing about the soursop. So I want to know if you'll have that same feeling. Okay? Thank you.
Okay, so as it relates to herbs, I believe that anything natural is good, but I think herbs should be used as a complementary kind of medicine and not in place of chemotherapy. My reason being, like I said earlier on, research has shown there are 15 different types of cancers. I don't think, 15 different types of breast cancers. I don't think there's enough research in herbs to say what herb is good for what type of breast cancer. So that's one of the reasons why I would not change chemotherapy for herbs, because I don't think there's enough research. The other thing too, if I look at the amount of research that's been going on with chemotherapy drugs have gone a long way. They have been changed. The side effects are now being properly managed, or better managed than it used to be 15 years ago. So in that case, if I know that with chemotherapy there's an 80% chance of me getting better, I'm not too sure what's the percentage chance of me getting better with the herbs. So I'd probably go for the chemotherapy in place of the herbs. But like I said, I believe in herbs, but I only believe in herbs as a complementary form of medicine.
Thank you so much, Dorothy. And I haven't forgotten the soursop, but we have another call, so we'll get back to the soursop. Thank you for calling. You're on Delore Factor Live. Hello.
Hello, good night.
Good night.
I was not hearing you. Good night to everybody.
Good night.
Can the fibro gland in the breast cause cancer? When the doctor said to you, your breast is fibro fatty. I do not know about that.
Can you repeat the question, please? It didn't come across too clearly.
Can fibro gland in the breast
Fibro,
cause cancer?
the thyroid.
I can't hear you. I will be listening to you on the TV.
No, we still haven't got the question too clearly, I'm afraid. I think she was talking about, she said, are there fiber glands on the can it cause Can it cause? I think she's talking about fibroids. I think
But
it's
she
maybe
said in the
fibroids in the breast.
Well, what I
There are no
thought she
fibroids.
was talking about, maybe she's
Fibroadenomas.
talking about, you know, some people have that lumpy breast. where they have-
Fibrofatty tissue.
Yes,
Yes,
I think
yes,
that's what she's
yes,
talking
yes,
about.
yes.
Fibrofatty tissue is not cancerous. It's a change in the structure of the breast, but it's not cancerous. And there's also a term called fibroadenoma, which is a tumor of the breast, but it is a non-cancerous tumor.
Okay. Have you heard of instances in St. Lucia, both Dr. and Dorothy, where women have been diagnosed with breast cancer, but because of their partner, they don't want to go and have a mastectomy? Have you? Oh, okay. So that's a yes, and we have a call. So what we're going to do is I have to go quickly to the break, and when we come back, we'll answer that question, the soursop, and the call. So make sure you stay with us.